Metabolic disruptions associated with ASD, and also many neurodegenerative disorders involve the N-acetyl aspartate. The energy production in the mitochondria correlates with the synthesis of the NAA, the N-acetyl aspartate, in the neuronal axons. Reduction of the concentration of the N-acetyl aspartate represents the loss of neuronal integrity and represents markers for neuronal dysfunction. Reduction in the concentration of creatine indicates deficient cellular energy metabolism. Spikes of choline, the component of the manufacture and the breakdown of cellular membranes, likely represent a greater cell growth and gliosis. Thus, choline is a marker of cell membrane turnover, and an increase in its level means gliosis or increased cellular proliferation. On the other hand, the decreased synaptic neuronal density consistent with the lower concentrations of both N-acetyl aspartate and the choline. Some ASD symptoms may result from abnormally low concentrations of GABA, the primary inhibitory neurotransmitter. In contrast to the low functioning areas of the brain responsible for speech, language, communication, and social interactions in low functioning ASD kids. High functioning ASD individuals exhibit hyperfunction of the brain areas responsible for these functions on the functional brain scans. It is as if brain is trying to compensate the deficit by increased activity. It is difficult for ASD child to interpret intentions of the words of others, as well as emotions, and also read the facial expressions of the others. That's why their brain has to put more effort to do so. Functions requiring integration of multiple distributed brain regions are particularly affected, and functions such as language that exhibit lateralization of function typically show greater recruitment of contralateral homologous regions in autistic brain. Morphological changes in ASD involves shifts in brain volume described as accelerated total brain volume growth around 2 to 4 years of age, predominantly due to enlarged brain volume of the frontal and temporal lobes, accelerated expansion of cortical surface area but not the cortical thickness, impaired maturation of the cortical white matter, followed by the arrest of the growth and possible decline in brain volume after around 10 to 15 years of age. It has been noted that by the age of 30, the autistic brain begins to acquire features similar to those of the dementia. Interestingly, that changes in cortical thickness have a specific pattern, which is characterized by accelerated growth in age before 2.5 years old, accelerated decline throughout much of later childhood, decelerated decline during early adulthood, and beyond that. Imagine that grain matter start overgrowing while the deeper line white matter becomes overstretched. That is why the connectivity is lost. After age of 3 and throughout adulthood, brain cortex starts to shrink. That's why some researchers compare the pattern of the brain, that pattern to the brain of the patients with Alzheimer's disease. Amygdala is involved in ASD, and it's going through the morphological changes depending on the age. Amygdala, as we know, is responsible for processing information about threat, so fear and fear response circuitry is mediated through amygdala. Interestingly, that the sense of fear, which is mediated by amygdala, is not based on the previous encounters or experience. Amygdala is responsible for primal fear in a way. It identifies the natural threats in the environment and activates the salvation responses. It enlarges beyond normal limits in early age, then subsequently stops to grow in teenagehood, ending up being smaller in adolescence than it is in a typically developing brain. Some parallels can be made with the PTSD, which also is associated with morphological changes in amygdala, often irreversible. Another similarity with Alzheimer's disease, amyloid beta protein in individuals with ASD. This is the protein that leads to formation of plaque and tangles in the brain tissue associated with Alzheimer's symptoms. While the link between Alzheimer's disease and autism is not being clearly determined, the presence of this protein in the brains of people with autism may signal early signs and symptoms. Researchers from the University of North Carolina reported an increased risk for later symptoms of Parkinson's disease in individuals with ASD. This indicates that the very early changes in the brain cell size, shape, and function associated with ASD may have long-lasting consequences, including higher occurrence of Parkinson's disease in ASD patients. I'd like to move the conversation towards the discussion of the existing treatment options from the arsenal of regeneration medicine and stem cells. The treatment of ASD and neurodegenerative disorders is multimodal. It is composed of conventional therapies, including social skill training, early intensive behavior therapy, applied behavior analysis, speech therapy, occupational therapy, together with psychotropic drugs, transcranial magnetic stimulation, hyperbaric oxygen treatment, sound therapy, cognitive and social behavioral therapy, hormonal therapies with oxytocin have also shown some promises in improving central ASD symptoms. Nutraceuticals, vitamins, herbals, mid-chain triglyceride oils, nutritional supplements, particularly line main supplement and conventional therapies have some effect in symptomatic improvement in ASD and many neurodegenerative disorders. And because ASD and neurodegenerative diseases are associated with impaired or slow neurogenesis in the brain, cellular-based transplantation techniques have shown a great prospect and therapeutic promises. There are at least two key action mechanisms of stem cells that can play an important therapeutic role in therapy of ASD and neurodegenerative disorders. The first one being paracrine effect, the secretome tool, cytokines, chemokines, and growth factors released by stem cells and they're responsible for repair and restoration of injured tissues, and second, and immunomodulatory properties. Both ASD and neurodegenerative disorders shown immune system abnormalities and strong pro-inflammatory cytokine production. ASD subjects shown an imbalance in innate and adaptive immunity as CD3, CD4, CD8 T cells, as well as the natural killer cells, the NK cells, are altered. Immune alterations are also represented by abnormal monocyte and macrophage responses with overproduction of pro-inflammatory interleukin-1 beta cytokine. The immune modulatory capacity of stem cells could restore these immune alterations. Stem cells are able to strongly inhibit CD8 and CD4 T lymphocyte and NK cell overactivation and proliferation by inhibiting pro-inflammatory tumor necrosis factor alpha and interferon gamma molecules and increasing anti-inflammatory interleukin-10 levels. This fact is confirmed by an animal model of autism and neurodegenerative disorders, in which stem cells, once transplanted, were able to increase anti-inflammatory cytokine production. The ability to modulate the immune system by stem cells is mediated via soluble factors released by stem cells under local chemical environment signaling. Another proposed mechanism by which stem cells are able to address the immune and inflammatory abnormalities in the cell-to-cell contact activation mechanism, by which stem cells are able to switch pro-inflammatory cells to anti-inflammatory ones. The ability of fetal neuronal precursor cells to survive, further differentiate, proliferate, promote neurogenesis and neuroplasticity, including stimulation of neurogenesis in hippocampus, ability to express neuromediators such as dopamine, for instance, and ameliorate symptoms of neurodegenerative disorders such as Parkinsonian symptoms or seizures in temporal lobe epilepsy, have been shown in multiple experimental studies, many of which involve a transplantation of neuronal fetal precursor cells across the species. For treating neurodegenerative disorders, neural stem cells from different parts of the fetal brain have been explored. The fetal neural stem cells have the ability to self-renew and are able to differentiate into neurons, astrocytes, and oligodendrocytes. And also, fetal neuronal precursor have the ability to secrete various neurotrophic and immunomodulatory factors that promote neuronal growth and suppress the action of pro-inflammatory cytokines that make them a potential candidate for treating ASDs and various neurodegenerative diseases. The fetal stem cell therapy appeared safe and well tolerated, both immunologically and neurodevelopmentally for the children. There's no immediate or long-term side effects were observed during the first year follow-up in that 1 year, more than 1 year of follow-up period. Equally, no apparent immunologically adverse reactions were noted as well. As for the clinical outcomes, there was a marked reduction in the mean score on the ATEC scale, reflected by lowering of the average rates in all subtests of the scale. A statistically significant reduction in the overall score on the ATEC scale was observed in the patients 12 months after treatment compared to before treatment. Also, a significant decrease in the mean score according to the sociability subscale was observed in the patients at 12 months after treatment compared to before treatment. Cognitive subscale results were 15 at 6 months post-transplantation and 8 after 12 months, compared to 21.4 before treatment. Clinically significant improvement in the behavior revealed a 12 months post-treatment score of 9.3 compared to a pre-treatment score of 24.5. According to the ABC scale, a significant decrease in the mean score was apparent in the patients after both 6 and 12 months, 63 and 54 respectively, compared to before treatment. A unique and extremely important data was obtained from one of the 12 patients who participated in a clinical trial of xenogenic neuronal stem cell transplantation study. A 69-year-old male patient with a 15-year history of Parkinson's disease had quite a remarkable near complete recovery from Parkinsonian symptoms following the xenotransplantation and had an incident of fatal pulmonary embolism a few months after the xenograft. Autopsy and histological examination with immunohistostaining of the brain showed aggregates of xenogeneic cells in the putamen and confirmed with staining to contain xenogeneic glia. Tyrosine hydroxylase immunostaining confirmed presence of xenogeneic dopaminergic neurons. NF70 immunostaining confirmed a large number of xenogeneic neurons axons extending towards host neurons. Remarkably, there was minimal or no immune cell infiltration as well as inflammatory responses around the xenografts. Of course, this is a single case and no generalization can be made. However, this case creates a strong precedent and serves as a great supportive argument for the xenogeneic cell transplantation proving homing, survival of the transplanting cells, and gives us direct evidence of its efficacy. Another study, this time from Italy, provides evidence that neural stem cells can safely survive in brain and have a potential to be used as a replacement therapy after a neurological injury such as a brain stroke. It has been demonstrated that fetal cells can also support a functional recovery from Parkinsonian symptoms, survive and migrate to lesion brain areas for up to 7 months. They differentiate into dopaminergic neural fibers in close association with host neurons and express a glial cell line-derived neurotrophic cell factor that may provide protective support to dopaminergic neurons. Here is a case presentation from our own practice. An 82-year-old male ex-police officer with Alzheimer's disease, dementia, and also other age-related conditions such as cardiomyopathy. Here is the PSC protocol that has been implemented. There were 2 sessions of stem cells done between the end of 2010 and first quarter of 2011. Feedback and the testimonies from the patient's family physician, wife, comments from the cardiologist, and of course the patient himself. There were multiple improvements in cognitive function, mood, memory, behavior, speech, quality of sleep, all day activities, and also in biochemical profiles of lipids, cardiac function, increase in left ventricle ejection fraction, even significant improvements in terms of the sleep apnea. The gentleman literally had a second life started after the age of 80 plus. He was traveling around the world and enjoying life for over 10 years after the stem cell transplantation.